Hello, my name is Brianna. I'm a nursing student that is going to be providing discharge teaching on a patient diagnosed with bilateral pneumonia. A background on this patient. This patient is a 91-year-old female who presented to the emergency room with shortness of breath, fatigue, and cough. She has a history of atrial fibrillation, hypertension, hyperlipidemia, transischemic attack, hypothyroidism, thrombocytopenia, and a recent myocardial infarction about a month ago, and underwent a cardiac catheterization with stent placement. Now, starting with the patient's discharge instruction. Hi, my name is Brianna. I'm the nursing student that is going to be providing your discharge instructions for you this evening. First, we are going to talk about the diagnosis that brought you in here. Your diagnosis was pneumonia. Pneumonia is the infection of the lower respiratory tract. It is most often caused by bacteria, viruses. You may develop symptoms such as fever, cough, trouble breathing, feeling weak, or having chest pain. It causes fluid to gather in the lower parts of your lungs, making it harder for you to breathe. It also does not allow for proper oxygen exchange in the lungs. This is why during your stay in the hospital, you were on oxygen at 2 liters nasal cannula. This was until the antibiotics were able to help decrease the pneumonia, allowing you to breathe better on your own. Some common signs and symptoms of pneumonia you should watch for are fever, cough, shortness of breath, a high white blood count. This indicates infection, chest pain, increased heart rate, increased respirations, fatigue or feeling tired, and loss of appetite. Some risk factors to getting pneumonia that relate to you are advanced age, your recent heart attack, recent surgery, which would have been your heart catheterization and stent placement, generalized anesthesia, which was given to you during your heart catheterization, recent hospital admission for your heart attack, and decreased activity since you've got your stent placed. You stated having generalized weakness and shortness of breath and cough on admission. You also had sputum production when coughing. These are all common symptoms of pneumonia and have decreased or disappeared since your admission. You also had an increased heart rate and increased respirations. This was your body's way of trying to make up for the lack of oxygen that was getting into your body. Because the oxygen exchange was impaired in your lungs, your body was working hard to get the oxygen to all of the cells in your body. This is why you felt tired and weakness all over. During your admission, we monitored your lab values. You had an increased white blood count, which is normal with pneumonia. It is now back to a normal limit. You also had a positive blood culture that you are taking antibiotics to help clear up. You also tested for respiratory viruses. You did not have any, which was a good thing. We also monitored your chest x-ray and the progression of your pneumonia, which showed great improvement since you've been admitted. Now we are going to go over the medications that you will be taking at home. We will go over what they are used for, how much you will take, how often you will take each medication, and side effects that you should monitor for. The first medication we are going to discuss is metoprolol, also known as Lopressor. This medication is used to decrease blood pressure, lower heart rate, and it is also used to prevent heart attacks. You are taking this medication because you have high blood pressure. You will take 25 milligrams 2 times a day at 8 in the morning and 8 at night. Some of the common side effects that you should watch for are fatigue, feeling increased tiredness, weakness, low heart rate, pulmonary edema, which could show as difficulty breathing, a rash, stuffy nose, and blurry vision. Know that you should take this medication as directed at the same time each day. Even if you feel well, do not skip or double up on missed dose. Take missed dose as soon as possible, up to 8 hours before the next dose. If you stop taking this medication suddenly, it can cause life-threatening heart arrhythmias, hypertension, and heart attack. Know that you should check your pulse daily and blood pressure every other week. And you should report any changes to your doctor. This medication may cause drowsiness. You should avoid driving or other activities that require you to be alert until you know the response of this drug. Change positions slowly to prevent orthostatic hypotension, which is the drop in blood pressure when you change positions fast. The second medication we will be talking about is Eliquis, also known as apixaban. This medication is used to decrease the risk for stroke by preventing blood clots. You will need to take 2.5 milligrams 2 times a day at 8 in the morning and at 8 at night. Some of the side effects you should watch for are bleeding and anaphylaxis. Know that on this medication, you may bruise and bleed easier and longer than usual. Notify your doctor immediately if signs and symptoms of bleeding occur, which include blood in the stool or urine, coughing up blood, headache, or dizziness, or drop in blood pressure. Also, notify your doctor if any injuries occur, especially head injuries. Notify your healthcare provider of this medication before any treatment or surgeries. The third medication we will be discussing is amiodarone. This medication is used for tachycardia, arrhythmias, and atrial fibrillation. You take this medication to help control your atrial fibrillation. You will need to take 200 milligrams once a day at 8 o'clock in the morning. Some side effects that you should watch for are low heart rate, heart failure, tremors, tiredness, dizziness, tangling of muscles, nausea, vomiting, constipation, low blood pressure, sensitivity to light, involuntary movements of the hands and legs, loss of appetite, heart palpitations, and numbness of the hands or feet. You should monitor your pulse daily. Make sure you take amiodarone as directed. If a dose is missed, do not take it at all. Call your doctor if you miss more than 2 doses. You should read the medication guide prior to the first dose and with each refill in case of any changes. The fourth medication we are going to go over is levothyroxine, also known as Synthroid. This medication is a thyroid supplement. This is used to treat hypothyroidism, suppression of goiter, and suppression of thyroid cancer. You are taking this medication to treat hypothyroidism. You will take 50 milligrams once a day at 6 o'clock in the morning. Common side effects that you should monitor for are headache, trouble sleeping, chest pain, nausea, vomiting, weight loss, and heat intolerance. Know that you should take this medication as directed at the same time each day. Take the missed dose as soon as you remember, unless almost time for the next dose. If you miss more than 2 or 3 doses, notify your healthcare provider. Do not stop taking this medication without talking to your doctor first. Avoid taking any other medications with Synthroid. Other medications should be taken 2 to 4 hours apart from antacids, irons, and calcium supplements. The last medication we are going to go over is vancomycin. This is an antibiotic. This medication is used to treat infections such as pneumonia. It binds to the bacteria cells to cause the bacteria cell death. You are taking this medication to help remove the pneumonia from your lungs. You will need to take 1,000 milligrams every morning at 8 o'clock. Some common side effects that you should look for are low blood pressure, rash, nausea, vomiting, diarrhea, chills, fever, neck or back pain. Know that you should take this medication as directed. Take the missed dose as soon as you remember, unless it's almost time for the next dose. Do not double dose if a dose is missed. Report signs of tetanus, dizziness, or hearing loss to your doctor. Notify your healthcare provider if you see no improvement in infection within a few days. Now we're going to go over activity. You should resume activity as normal as tolerated. You should also increase walking, as walking is a good activity to prevent reoccurring pneumonia. You should perform coughing and deep breathing exercises frequently to allow for the expansion of your lungs. You should also use your incentive spirometer as directed, which is every 2 hours while awake for 10 times. I'm going to go over how to use the incentive spirometer. You should sit up straight as you can. You may sit in the chair or in your bed. Hold the spirometer in an upright position. Place the marker on the level the doctor suggests, which for you was 1100. This is your goal as to how deep you will take your breath. Once you are able to reach that level, you can rise the marker to a higher number. This will help you take deeper breaths. Before use, you should breathe out normally. Place the mouthpiece in your mouth and tightly seal your lips around it. Breathe in slowly and deeply through your mouth. Breathe in as long as you can. This will make the ball in the clear chamber rise. Try to rise the ball to reach your goal. If you have trouble reaching your goal, make sure your lips are sealed fully around the mouthpiece. Try thinking about sucking the last bit of a milkshake with a straw when you breathe in. When you cannot breathe in any longer, hold your breath for as long as possible, but for at least 5 seconds. Remove the mouthpiece from your mouth, then breathe out slowly. Rest for a few seconds and breathe normally. The ball will return to the bottom of the chamber. Then repeat these steps for 10 times every 2 hours. Once you are done, take a deep breath and cough to clear mucus from your lungs. Your goal for the next 10 breaths will be to the level that you set on the incentive spirometer. Move the marker to this number for the next set. By using the teach back method, I have seen you use this incentive spirometer, and you explained that it is used to help open up the lungs and allow for deeper breathing. Health promotions. You should stay away from smoke-filled places. Avoid any other things that may cause breathing problems like fumes, pollution, dust, or other common allergens. If you have an inhaler to take when you feel short of breath, be sure to carry it with you at all times. Then you can take it when needed. Take all other medications as directed. Drink lots of water, juice, or broth to replace fluids lost through running nose or fever. Take warm, steamy showers to help soothe cough. Use a cool mist humidifier. This will make it easier for you to breathe. Use hard candies or cough drops to soothe throat and relieve cough. Wash your hands often with soap and water for at least 20 seconds, especially after coughing or sneezing. You can also use alcohol-based hand sanitizer. This works well. When should you call your doctor? You should call your doctor if you have trouble breathing that you can only say 1 or 2 words at a time. You need to sit up right at all times to be able to breathe, or can't lay down flat without feeling short of breath. When you have trouble breathing when you are talking or sitting still. When you have shortness of breath and has not gotten better after a few days. When you cough up blood. When you have a fever of 100.4 or higher, or chills even after taking your medication. When you have symptoms that we talked about earlier for pneumonia, such as fever, cough, shortness of breath, tiredness that lasts more than 3 to 4 days, you are still coughing 3 to 4 weeks after taking medication. Now we're going to go over ways to prevent pneumonia in the future. Get your flu shot each year. Ask your provider if you need to get the pneumonia vaccine, which is typically taken after the age of 50. Wash your hands often, stay away from crowds, and ask visitors who have a cold to wear a mask. This is the end of my discharge teaching for this patient. At this time, I would ask if she had any questions, answer any further questions that might arise, and allow the patient to get ready to leave the hospital. Thank you.